All right, welcome back everybody, and we're going to continue our discussion on ear infections. And if you haven't watched the first video that we did on ear infections, where I had a nice drawing of an ear and the tube, the eustachian tube, and the connection between the nervous system and drainage of the ear, nose, and throat, I'd like you to go back and watch that video on our news feed, because that one really describes how ear infections occur. And we talked about how it's not an infection issue, it's a drainage issue. So the next thing, the things that I want to address in this video are, number one, how do kids, what are the most common reasons that we see that causes a drainage issue or an irritation on the nerves that control the drainage aspect of things with the whole ear, nose, and throat? What occurs? What do we see in a kid's case history that would leave clues as to that being the problem and how that problem arises? So we're going to talk about that in the case history, and then we're going to also talk about the some natural remedies that people utilize that can help with ear infections as well. And the most important one that we're going to talk about as well, which is probably no surprise to anyone here when I talk about the most important aspect of it, or the most important remedy. So first off, when we think about an ear infection, first off, many years back, the CDC and the American Pediatric Association actually recommended, and still do, if you go to the CDC's website, they recommend a watch and wait approach when it comes to ear infections. In fact, they recommend waiting at least 2 to 3 days before giving any sort of antibiotic. And the frustrating thing is, while that is an encouraging approach to more of a conventional or a naturalistic approach to helping that, it's not a fun one, because you're literally going to the emergency room and they would say, hey, just watch and wait. Yeah, your kid's in pain and he's struggling, but just watch and wait it out. It does leave the window open for the downsides of having antibiotics when they're not needed, and the side effects associated with that, both short term and long term. But the other frustrating thing is that even though they recommend that watch and wait approach, that their solutions after that happens is things like ibuprofen, acetaminophen, and rest and fluids, and those things are going to help your kid feel better, but it's not going to get to the root of the problem. It's not going to fix that drainage issue and allow things to drain better. It's not going to fix the plumbing in that ear, nose, and throat plumbing pipe. So when we sit down with a parent and we go over the case history with a parent and we talk about their child's health, the biggest, most important thing that kids go through that could cause an imbalance to that upper neck, that irritates that upper cervical spine, that causes that eustachian tube to clamp up, close down, and not drain properly, is the birth process. Especially any birth intervention. If you even a normal natural birth is 40 to 60 pounds, the research shows, of pulling and tugging on the head and neck. And any intervention on top of that, be it a C-section, a long, strenuous, laborious delivery, a cord wrapped around the neck during the birth, a vacuum extraction, a forceps delivery, those just amplify the amount of stress and tension in that upper neck area, and is oftentimes the biggest cause of why that drain pipe gets plugged up to begin with. But other things that we'll see in a history, let's say if a parent brings in their kid and they're 2 years old, oftentimes we'll hear things like, yeah, my kid had colic when they were a baby, or my kid had trouble latching, they had reflux, they had torticollis when they were a baby, they had a flat spot on one side of their head, which is a sign of lack of proper mobility in that upper neck area. Those are all clues that kids struggle with, and they're all common things that kids struggle with. And when we go and we deal with those issues in those moments, those early infant stages, they oftentimes grow out of those things, but they don't really grow out of it. What they do is they grow into ear infections. And those are all clues that that upper cervical area is out of balance big time. And it originates oftentimes from that birth process. And that creates an issue with the upper cervical spine. Now, when you have an issue with the upper cervical spine, again, if you reference that previous video we did, we show how the C1 nerve, this upper cervical nerve, it controls the little muscle that goes to the eustachian tube. That muscle, if it gets tight and stressed, it causes the eustachian tubes to not drain properly, giving it the body an easy place to let a bacterial or viral infection proliferate. The other aspect, the other side of that is when you have an imbalance to the nervous system anywhere in the body, it causes a sympathetic dominant state in the body, a fight or flight, stressed out state in the body, which in turn, twofold, will lower the body's immune system. Sympathetic dominant or hyperdrive over dominant sympathetic states cause the immune system to become suppressed, and that in turn can become and make the body more prone to inflammation, more prone to infection or sickness or illness of any kind as well. The other third aspect of that is when you have an imbalance to that upper neck, it creates tension in the musculature of the neck. And that tension, our lymphatic system, which is our immune system, is located, many lymphatic system, our lymph nodes are located in the neck. And in that neck and facial or neck and sinus area. And if you have a lot of stress and tension, the lymphatic system relies on mobility and motion to drain. It's not like the heart. The heart pumps to circulate blood. Well, the lymphatic system does not have a pump. It relies on mobility and motion. And if you have lack of motion, if you have nerve irritation in the upper neck or in the neck in general, then that causes the musculature to tighten up and the lymphatic system won't drain as effectively. So there's really three different ways that this can compound, and that is irritation to the nerves from that upper neck that control the tubes. Secondly is a sympathetic dominant nervous system fight or flight state, suppresses the immune system. And number three, the lymphatic drainage aspect of things. The whole lymphatic system just does not drain. And in our office, we have two different scans that are really great at identifying, the first one being dysautonomia or irritation on the nervous system. And that picture is going to look like the one we're going to throw up on the screen here. And on this photo, you can see that there's a lot of color in that upper neck area. That is a sign in this particular case that the nervous system is irritated and inflamed in that critical area that influences ear infections. The second scan that we're going to have pop up here is something called an EMG. That is measuring the muscle tension in this case, in the whole spine. But in this particular picture that you see, especially, we see a lot of extra tension in that upper neck and mid neck area, which is going to correlate with the whole lymphatic drainage aspect of things. If you have tension in the muscles, that lymphatic system is not going to drain properly. So those are just two ways that we can help identify, along with the case history. You put all that together, case history, scans, that's going to give us all the clues that we need to be able to not only just help the kid with ear infections, but to fix the problem, to get in there, fix the plumbing so that that stuff doesn't get backed up and infected again. And that is the goal with neurologically focused chiropractic care, is we're influencing all of that. We are taking stress off the nervous system that's improving the way that the immune system functions. We are taking stress and tension off the upper cervical nerves if they are in fact subluxated or irritated, and that's going to take pressure off the tubes. And number three, we are improving and decreasing stress and tension and improving range of motion in the neck, which is going to help with the drainage factor as well of the lymphatic system. So the number one thing, I said at the beginning of the video, the number one thing that we can do that we've seen helps with kids with ear infections is, of course, this is the one I said that's not going to surprise you, chiropractic care. If we can utilize and we can improve a scan that looks like the ones that we showed you, that kid is going to be much healthier, much well on their way to having less ear infections. And then some other things that are very beneficial to do that are more naturalistic in remedies that you can try as a first step, as opposed to running and going the antibiotic route, is things like warm or cold compress on the ear. That can help relax the musculature. That can help relieve some tension and pain in that ear. Things like hydrogen peroxide, rinsing it out, garlic oil drops, colloidal silver drops in the ear. They even make those ear candles that are little wax candles that you place in the ear and you light the end on fire. I know that sounds crazy, but the fire on the end of the candle actually creates a vacuum and sucks any earwax or anything out of the ear that could be irritating the ear as well, especially with like swimmer's ear, where the infection is actually on the outside of the eardrum as opposed to the inside of the eardrum. And those, and obviously any supplements that you can take, elderberry syrup. We have a supplement here that we sell called Congaplex that is really good to benefit your immune system. Anything that you can do to improve your body's immunity to, especially times of year when gunk and stuff, kids are more prone to getting sick. Those things are going to help as well, beefing up the immune system. But the most beneficial factor that like I said, is chiropractic care. I've seen hundreds and hundreds of kids with ear infections, and that is one of the most effective ways to help kids that are struggling. So thanks for watching this video. This concludes our little mini series on ear infections, and we'll talk to you next time.